What is the kidney transplant journey for ESRD patients? Imagine living with a condition where your kidneys no longer do their job. That's what happens in end-stage renal disease, or ESRD. For many, a kidney transplant can be a life-changing step. The journey begins with diagnosis and deciding if a transplant is the best option. Doctors usually recommend transplantation because it often offers a better quality of life, longer survival, and fewer dietary restrictions compared to long-term dialysis. Some patients might even get a transplant before starting dialysis, known as a preemptive transplant, which can lead to even better outcomes. Once ESRD is diagnosed and transplant is considered, the patient is referred to a specialized transplant center for a thorough evaluation. This process involves many tests to check if the person is a good candidate. Blood and tissue typing are done to find compatible donors. Imaging tests like ultrasounds or CT scans help assess the kidneys and other organs. Heart tests are important because heart disease is common in kidney patients and can affect surgery safety. Doctors also screen for infections, cancers, and other health issues. Psychosocial and nutritional assessments are part of the process to ensure the patient is ready for the lifestyle changes after transplant. Financial counseling is also provided to understand costs related to medications and ongoing care. After passing the evaluation, the next step is to get on the transplant waiting list if no living donor is available. The waiting time depends on factors like blood type, tissue compatibility, and how long the patient has been on dialysis. Some programs also include expanded criteria donors, which means kidneys from older donors or donors with certain infections like hepatitis C. These options can sometimes shorten the wait. Finding a donor is a critical step. There are two main types of donors: living donors, often family or friends, and deceased donors who have recently died. Living donors usually provide a kidney that leads to better outcomes and shorter waiting times. Deceased donor kidneys are allocated based on compatibility and urgency, and waiting times can vary widely. When a suitable donor is found, the transplant surgery is scheduled. During the operation, the donor kidney is placed in the lower abdomen and connected to blood vessels and the bladder. The patient's own kidneys are usually left in place unless there's a specific reason to remove them. Surgery typically lasts a few hours, and most patients stay in the hospital about a week afterward to recover and be monitored. After the transplant, lifelong care is essential. Patients must take immunosuppressive medications to prevent rejection of the new kidney. Regular blood tests monitor how well the kidney is functioning. Doctors also watch for side effects from medications and screen for infections and cancers, since immunosuppression can increase these risks. Lifestyle adjustments, like eating a healthy diet and avoiding infections, help support the new kidney's health. It's important to remember that not everyone with ESRD is a candidate for transplant. Factors like advanced age, severe heart disease, recent or active cancer, or uncontrolled mental health issues can make someone ineligible. The transplant team carefully evaluates each person's risks and benefits. For example, if someone has a history of kidney cancer, additional assessments are needed before proceeding, because immunosuppression can sometimes increase the risk of cancer recurrence. Overall, the kidney transplant journey involves early evaluation, waiting for a suitable donor, the surgical procedure, and ongoing management. It offers many patients a chance to live longer and enjoy a better quality of life compared to dialysis alone. If you or someone you know is considering transplantation, always consult with healthcare professionals to understand individual risks and options.